let us begin our webinar because I'm sure that everyone is excited to learn and hear from our guest speakers. So Dre, please introduce our very first speaker for today. All right.
All right. So I guess everyone's excited now. So our speaker for today, he is an epitome of a successful provinciano. So he doubled as a crew in a fast food chain during the student days until he finished his nursing course with honors and made his parents proud with his sterling performance in the nurse licensure examination. His story of success represents the aspirations of today's nurses. So today, he is co-listed with Bill Gates in the 25th edition of Marquis Who's Who in the World. He is the first Filipino to write a test preparations guidebook for the world's leading health sciences publisher, Mosby Elsevier, and Jones and Bartlett Publishers USA. He has over 25 years of teaching and administrative experience in test preparations, including graduate and undergraduate nursing programs. He was named one of Go Negocio's first 50 inspiring Filipino entrepreneurs and Philippine Graphics Magazine 2006 Young Leaders of the Philippines. He received the MVP Bossing Award for Education, the Agora Award for Entrepreneurship for the Philippine Marketing Association, the SME IT Award for Innovation for the Philippine Internet Commerce Society, the 10 Outstanding Filipino Entrepreneurs from Entrepreneur Magazine, and the Young Market Master of Entrepreneurship from Mansmith and Fielders. He is the first Filipino nurse entrepreneur to be accepted as a member of the prestigious Ernst and Young Entrepreneur of the Year Academy. Currently, he serves as a trustee of the Philippine Center of Entrepreneurship. He finished his Bachelor's of Science in Nursing cum laude and Master's of Arts in Nursing summa cum laude at the University of Santo Tomas. He was a board top-notcher in the Philippine Nurse Licensure Examination, where he obtained a rating of 89.20. He obtained his post-baccalaureate certificate in e-learning design and Master of Education in Learning, Design, and Technology at the Pennsylvania State University, where he finished both courses with a GPA of 4.0. He received his training on online facilitation at the Harvard Graduate School of Education. So everyone, let us all welcome Sir Ray A. Gapuz. Hi, Sir Ray.
Hello, good morning everyone. A pleasant morning to you, Sir Miko. Pleasant morning to you, Drea. Maayong buntag sa ating mga kababayan sa Visayas. At naimbag na bigat kada kayo amin apo sa aking mga katribo naman dyan sa Ilocos, La Union, Pangasinan. Okay? At of course, our former chairman of the Board of Nursing is already in the house. She just sent a message. Good morning po, Dr. Glenda Arquiza, and to all our colleagues to be and some of those who are guiding them now. I know some of their clinical instructors could be joining them in this event. Welcome po, and we now have 946 participants, and meron po tayong mga na-cluster. They'll be having a delayed telecast kasi hindi kinaya ng Zoom natin na max out. Okay, so we'll be having some of them in batches after this, and that's gonna be through the technology that the IT team of Health Carousel and their Gapuz system have formulated, because na-max out po yung ating daming gusto, Sir Miko, at ang daming gusto, Ma'am Dre. Okay, thank you, Health Carousel, for coming up with this specific event. And I tell you why, guys. Bakit maraming may gusto nito? Well, because when we did this pilot, okay, free test preparations webinar last July, well, more than half of the placements in the top 10 joined this, including the #1 placer. And she was so happy, and she said, sabi niya sa akin, Sir, alam mo, nandun ako sa 2 session. Maraming salamat po. So without further ado, once again, I'm Ray Gapuz. I'll be your mentor for the first session, and it's gonna be on, definitely, okay, the SATA thing about the test. So once again, I'm your fact check buddy, so please don't forget to read through the check mark in between the words fuck and buddy because otherwise it doesn't sound well. Okay, so reminder, para po sa inyong lahat, sa pagmamahal po ng Health Carousel ni Ma'am Glenda at ang ng inyong abang lingkod, ibibigay po itong slide na to sa inyo. Okay, so just listen, sit back, and relax. Hindi nyo kailangang magsulat. So those all of you who attended the day session will receive a copy of this presentation. Plus, may bonus pa. And let me announce it now. There will be a full session on SATA that I will conduct, okay, free, and that's going to be on November 8. That would entail a separate registration, including materials, para po matulungan natin lahat na nangangailangan ng tulong, lalong-lalo na sa mga probinsya, certified PROMD. Okay, so naimbag na bigat yung amin apo, ang aking mga tropang kamudirit, okay, ang mga tropang maniniyot, nandyan na rin, ang mga tropang dulpot at saka dugyot. Ang cute naman ng mga pangalan ng mga tropa-tropa ko. They're joining my boot camps every Sunday. Okay, those of you who have not joined my boot camps, the boot camps are usually free every Sunday with free materials. Please watch out for the announcements when the next one will be. Okay, so the basic question that we have is that who's afraid of SATA? Okay, I know you are anxious about SATA. Ano ba yung SATA na yan? Okay? Okay, a lot of questions. Paano ba yan sasagutin? How will I cope with it? How will I study for it? Okay, so before we get to start, let's have inspiration from the mail. Naka-max out na tayo. Maximum 1,000 ang participants natin. Sir Miko, congratulations. Ma'am Dre, congratulations, Health Carousel. And of course, our heartfelt gratitude to Dr. Glenda Arquiza for the opportunity she granted to join us today. Okay. So it's entitled A Big Thank You. This is from Mary Rose Arsenal. She sent this after the July session that we had. Sabi niya, Sir Ray, your story and your past is a great inspiration to me po. I graduated nursing 12 years ago and opted to working in a different field. Dala na nga ng kahirapan ng buhay. Di ko po kaya ang mag-review center noon. And so here I am after 12 long years trying my best na sana maging RN na po at matupad ang pinangarap kong propesyon at para makatulong na rin sa bayan. Maraming salamat po sa lahat ng encouragement at tulong sa pagre-review. Mabuhay po kayo at stay healthy po para mas marami pa po kayong matulungan. Well, that was immediately after the first session we had in July. I did not expect another email from her because that was already done in the run-up to the board exams. But lo and behold, after the result came out, ito ang email ni Mary Rose Arsenal, Sir Ray, with exclamation point. Pumasa po ako sa exam, having goosebumps reading it. 5 exclamation point. And then she says, umiiyak pa rin po ako sa tuwa ngayon kung di po dahil sa gabay ninyo at sa mga free YouTube videos ninyo na pang local ngayon ang ating focus doon sa YouTube channel. Nakamit ko po ang pinapangarap kong lisensya. After 12 years and after 2 failed takes, matatawag ko na rin ang sarili ko na ganap na nurse. Marami pong salamat sa inyo na way bigyan po kayo ng mahabang buhay at lakas para mas marami pa po kayong matulungan. To God be the glory. Nagmamahal, Mary Rose Arsenal, at meron na yung 2 words after her name, RN. Make sure that means registered nurse, hindi rejected nurse. Pag nakapunta ka na America through Health Carousel, magiging RN, rich na. Okay, so everyone who believes that they will attain their great American dream through this session, ilagay nyo ngayon sa webinar, yung magsusulat nito, magtatap sa board, tapos ang rating not less than 80%. Everybody write, I'm next. Go. Okay, sulat natin. Lagay natin dito, I'm next. Come on, everybody. Na naniniwala, ayan, na sila na ang susunod. Katulad ni Mary Rose Arsenal. A lot of nice stories and anecdotes. Ito yung nagbibigay sa akin ng lakas ng loob. After surviving COVID, it's actually critical COVID pneumonia and having a second chance of life. This is now my mission to help you out, class, okay? Attain your great American dream. Been there, done that. It's my time to give back through Health Carousel Philippines. So remember this, class. Those of you who are feeling low at the moment, they're depressed, walang trabahong parents, they feel so low, walang pera, don't despair. We're offering you something, okay? And remember this, our greatest glory is not in never falling, but in rising every time we fall. Okay. So, paano ba natin tatagalugin yung ano na yan, mensahe na yan? Paano ba tatagalugin yung in rising every time we fall? Pwede ba natin sabihin na, okay, in rising every time we fall? So kumain tayo ng kanin para hindi ka bumagsak. Tama ba yun? Tama ba yun? In rising, every time we fall, di ba rising, kakain ng kanin para hindi bumagsak. Okay. So anyway, let's begin our session. And okay, before we get to start, I'd like to congratulate this one of my favorite students that I mentored, Jervilea Kabatbat Kabiko from the University of Northern Philippines, who passed the USRN under my mentorship for the California State Board of Nursing. And what's nice about Jervilea is that, ito, yung tatay niya, estudyante ko, ngayon siya, estudyante ko na rin. Naging USRN na siya through our system. Nakakatuwa, ganun na pala ako katanda. So I posted this on on my Facebook, proud mentor here of the father and now the daughter. Okay? Biro mo, mentor ako ng the father, okay, of the daughter, okay, and of the Holy Spirit din. No, hindi naman. Okay, so she posted a quote from the Bible, either make the tree good and its fruit good, or make the tree bad and its fruit bad. For the tree is known by its fruit, and that's Matthew 12, verse 13. Okay, way to go. Everybody again who believes they can do this route, say, I'm next. Come on, everybody. Okay? I'm next. Eh, nakakatuwa minsan maturuan. No? Naturuan mo yung tatay, naturuan mo yung anak. Okay. And this is one of my favorites. Please do keep this in your heart, colleagues. You may encounter many defeats, but you must not be defeated. In fact, it may be necessary to encounter the defeats so you can know who you are, what you can rise from, how you can still come out of it. Believe. So everybody, type it on our chat box. I believe. Come on. I believe. Okay. I believe, and you are next. Okay, so what is SATA? Okay, SATA is actually an acronym for Select All That Apply. Maraming natatakot sa SATA. Actually, hindi siya nakakatakot eh. Alam mo kasi, ito ay kombinasyon lang ng paborito nating type ng question nung tayo nasa elementary. Okay? Select All That Apply is just clustered multiple choice with multiple response. Dapat hindi mo yan kinatatakutan kasi pinagsama-samang true or false lang ang SATA. Kaya pag nakakita ka ng SATA question, don't take a look at the big picture right away. Go one by one, piece by piece. Analyze each option. Ask yourself, is this true? Is this false? Is this true? Is this false? Sir, anong strategy ang gagawin ko? Eh minsan, true or false na nga lang ang options, eh namamali pa ako. Normal lang naman yan sa atin. Okay, so how do we deconstruct SATA questions? That's my job for today. Okay, so let's move on, colleagues. So this is my basic reminder to everyone. Strategize, do not memorize. Sakto lang. Meron pa tayong approximately more than a month to go over our notes. And this is the right time that you get to know the 5 common strategies that I'm going to share with you guys. It has worked for me. It has worked for the students I've mentored. And I'm sure it's gonna work for you, especially to those who say, I believe. Okay, so what's our main strategy? Our main strategy is based on the study done by Poundstone in 2017. Anong sabi dun sa research? Nag-analyze sila ng true or false types of questions sa mga exams. At ito ang kanilang na-find out. True answers are more common than false answers. True answers are usually 56% of the total items and false answers are 44%. Therefore, paano natin i-convert yan sa pagsagot natin sa SATA questions? So, if you have like 5 options in one SATA question, kasi minsan either 5, 6, or 7 options yan. Wag namang gawing 9 options, parusa na yon. Okay? So 5, 6, or 7 options. 56% of that would be true. So dapat, kung 5 yung options, approximately 2 to 3 of those items, tama. So dapat isipin mo kagad yun, minimum ng 2 to 3 ang tama dito. False answers would be 44%. At may 2 dito na mali. Okay, so that's a basic strategy. Sa bawat question, 2 to 3, kung 5 ang options, ay tama at 2 ay mali. Okay. So in a nutshell, we're saying that if you are going to answer SATA questions, chances are you would be choosing at least 2 or 3 correct answers. Yun na lang hanapin mo. Ngayon, Paano natin yan gagawin? Here we go. So with that, who's afraid of SATA? Nababawasan na, I am sure, yung anxiety ninyo. Okay, so here are the 5 strategies to help you get through the SATA questions. Let's deconstruct it the Ray Gapuz way, making it easy for you, class, to turn your great American dreams to reality. Okay, strategy number 1. Cluster, compare, and contrast. So ano ibig sabihin ng cluster, compare, and contrast? Well, cluster, compare, and contrast simply means that when you're studying, for example, signs and symptoms, risk factors, diagnostic tests, all you have to do is to cluster it. And if there are conditions that are the direct opposite of other conditions, like for example, Addison's is the opposite of your Cushing's disease, Cushing's the opposite of Addison, all you have to do is to compare and contrast. Ngayon, ang tanong, sir, paano? Here are specific questions, okay? Now, once again, colleagues, no need to copy, okay? I'm going to give you a copy of the slides, okay, through your email after today's session. So mamayang hapon lang yan, nag-start nang magsisend ang ating staff. Okay, example. Cushing's disease, bigla mo sasabihin, ano na nga ba yung Cushing's disease? Alam ko, nabasa ko to sa endocrine system eh. Tapos hindi mo na maalala kung ano. Now, tapos bigla ka nagkaroon ng ganitong question. Which of the following food can be included in the diet of a client with Cushing's disease? Select all that apply. Tapos may banana, oranges, grapefruit. Naku, ano pa? Paano ba? Yung diet nga na may Cushing's, hindi ko maalala eh. Tapos ang binigay pa sa akin, examples of food. Okay, so ganito lang gagawin dyan, class. All you have to do is to recall your concepts. First, know that your Cushing's disease is due to an abnormality of your adrenal glands. Take note that the adrenal glands are located on on top of your kidneys. Kaya nga tinawag yan na adrenal. It's added to the renal. Okay? Now, question. Okay. Anong shape niyan, sir? Parang triangular. Parang yung lucky cookie na pag kumakain ka sa Chinese restaurant. Ganon ang shape niyan. Okay. So, it has 2 main parts. Okay. You have the cortex and the medulla. The cortex actually secretes your glucocorticoids or cortisol and your mineralocorticoids or aldosterone. The glucocorticoids is responsible for gluconeogenesis or formation of sugar. Mineralocorticoids is responsible for sodium retention and potassium excretion. In essence, your aldosterone is responsible for maintaining sodium and potassium balance. Okay, now, if you have an underactivity of the adrenal gland, so you'll have Addison's disease. Okay, if you have overactivity of the adrenal glands, then you will have Cushing's disease. Okay, now, sometimes you will meet the term hyperaldosteronism. So sa hyperaldosteronism, you only have increased aldosterone. That's known as Conn's syndrome. Okay? So, iba yung Conn's sa Cushing's. Okay? Let's type it here. So pag sinabi natin Conn's syndrome, it's only the aldosterone that is affected. In Cushing's disease, both your glucocorticoids or cortisol and mineralocorticoids and aldosterone are affected. Okay, way to go. Now, what about the medulla? Well, the medulla secretes your catecholamines or norepinephrine and epinephrine. Okay, these are the hormones responsible for your body's fight or flight response. And in essence, it also affects whether our patient's mood will be that of depression or that of mania. Now, pay particular attention to this fact. What happens pag nagkaroon ng tumor sa adrenal medulla? Then you have the condition pheochromocytoma. Oops, natanong na yan dati. When you say pheochromocytoma, you have an excess epinephrine and norepinephrine. So what will be the signs and symptoms? So epinephrine, norepinephrine, fight or flight, tataas ang blood pressure mo. So hypertension is the most common manifestation of pheochromocytoma. Therefore, your priority should be taking the patient's blood pressure. And then the patient would also have 4 more H. So hypertension, headache, hyperglycemia, hypermetabolism, and hypercalcemia. Diyan mo kung tatanungin, paano nagkaroon ng hypercalcemia kung ang excess ay epinephrine at norepinephrine? Well, that is because when you have increased epinephrine and norepinephrine, there could be potential increase in the secretion of parathormone that withdraws calcium from the bone. So that is the hormone that withdraws calcium from the bones. Okay? Pay particular attention to that concept. Okay, so Now, knowing your basic concepts, let's move on now to what happens in Cushing's disease. So in Cushing's disease, you have an overactivity of the adrenal glands. Therefore, your patient will have an excess secretion of glucocorticoids or cortisol that produces your sugar. So your patient with Cushing's disease will have increased sugar, and there's excess secretion of mineralocorticoids or aldosterone, which means your patient will have increased sodium due to sodium retention and decreased potassium due to increased excretion of the potassium. Note that I color-coded decreased potassium. Why? Because from this pathophysiological processes, we would be able to identify our functional concept. Yung mga kasama lagi sa bootcamp ko and those who attended last July, you know for a fact what functional concepts are. This could either be a word, a phrase, a sentence, or even a paragraph that gives direction on how you should deconstruct a question specific to a specific concept. Okay, so let's formulate our first functional concept. In Cushing's disease, everything is up except potassium. So Cushing's, my U, everything is up except potassium. Therefore, in Cushing's disease, sodium is up. So what diet do we provide? Low sodium. Potassium is down. So what diet do we provide? High potassium. Question, alam mo na ang diet, low sodium and high potassium. Paano ay ang binigay example ng mga food? So this is another concept. Remember this. If it is found up in a tree, it's high in potassium. If it is found down the soil, it's high in sodium. Minsan na nakakatuwang example ko sa aking mga estudyante. Kung up in a tree, high in potassium, down the soil, rich in sodium. Ano ang kape? Sabi ng estudyante, sir, pinupulot yun sa lupa di sodium. No, galing yun sa tree, nahulog sa lupa. So potassium source pa rin ang coffee. Okay, having that in mind now. Up in a tree, high in potassium. Down the soil, rich in sodium. Let's move on. So let's try answering a sample question. Ito na yung sample question kanina. Gamitin na natin yung ating mahika. Sabi natin, di ba? Up in a tree is high in potassium. So, ang diet na binibigay sa pasyenteng may Cushing's disease, dahil mababa ang potassium, should be something that's high in potassium. Therefore, do we give bananas? Yes. You know, one piece of bananas contain approximately 450 milligrams of potassium. And on a daily basis, kailangan natin ng 3,500 milligrams ng potassium. So therefore, ilang bananas ang kailangan natin per day? Around 7 to 7.5 pag medium size yung banana mo. Pag malalaki yan, 3 to 4. Ano ibig sabihin nun? Ano implication? So kailangan mo ng 7 to 8 bananas per day. Dapat yun din ba ang number ng boyfriend? O ng jowa, isang boyfriend, isang banana, at iba-iba ang size, di ba? May saba, may lakatan, latundan, at senyorita. Okay. Anyway, oranges, again, up in a tree. So one orange, approximately 100 milligrams of orange contains 180 milligrams of potassium. So high potassium pa rin yan. Kaya lang kailangan natin ng around 90 to 20 pieces of oranges para ma-meet mo yung daily requirement. So kasama pa rin yan. Next, grapefruit. Ang grapefruit po ay hindi grapes, iyan po ay suha. Okay? At pag sinabi natin grapefruit, okay, yung 100 grams ng grapefruit would contain approximately 135 milligrams of potassium. Therefore, pag ginawang tanong ito, alin dito ang best source of potassium? Bananas, oranges, or grapefruit? Still bananas, 450 milligrams per piece yan. Okay? Now, apply natin, down the soil, rich in sodium. O yung potatoes, di ba binungkal sa lupa yan? That's rich in sodium. Mashed pa yan. Ibig sabihin na process na. So approximately, it could give you, 100 milligrams could give you 190 milligrams of sodium. So we put an X. Hindi yan pwede sa may Cushing's kasi mataas na ang kanyang sodium, kaya dapat low sodium ng diet. Canned tomatoes o tomatoes, malapit uli yan sa lupa. Canned pa. It means it's processed. So it gives you approximately 230 grams of sodium. So once again, we put an X. And then last but not the least is spinach. Okay, malapit din yan sa lupa. So it gives us approximately 125 milligrams of sodium with 1 cup of spinach. Therefore, the correct answers are 1, 2, and 3. Now it has become easier. Okay, you have just to have that guide, the functional concept. Something up in a tree, high in potassium. Anything down the soil, rich in sodium. Maraming salamat, Judy Ann. Sabi niya, galing naman, Sir Ray. Salamat po. Natututo ka ba? More to come. At mas marami. Yung session ko on July 8 would be 5 hours straight with free materials. I'll give that to you, class. Let's now move on. Paano, sir, gagamitin niya strategy na yan? Kung bleeding disorders naman pinag-uusapan, bleeding disorders in pregnancy, walang katapusang abruptio placenta, walang katapusang placenta previa. Eto na tayo. Let's have a sample question for MCN. Which of the following risk factors are found in abruptio placenta and placenta previa? Sasabihin mo, pag nabasa mo itong ganitong question, parusa naman yan, sir. Yung ang risk factor na abruptio placenta, hindi ko pa makabisado eh. Ayun, tinanong pa, found in both. So, ibig sabihin, pag sasamahin ko pa, i-organize ko pa yung thoughts ko. Okay, take note, class. Ang pinag-uusapan dito, risk factors. Yung kanina, ang tinignan natin, dietary modification. So, applicable din ang SATA sa risk factors. O, tingnan mo, may code pa siya, thumbs. Pero ang sasabihin mo nga, alin dyan ang parehong meron sa placenta previa at abruptio placenta. Eto na naman tayo. Let me give you a guide. Okay, so, here's our functional concept. When you say abruptio placenta, the main problem is abnormal separation of the placenta. Okay, so the bleeding could be overt. In fact, meron nga silang tinatawag, yung ibang authors, chronic abruptio daw. Kasi walang bleeding pero covert pala yung bleeding. I should say covert. Hindi napansin na nasa loob pala ng placenta yung bleeding. In placenta previa, you have painless, okay? Bright red bleeding. Ang problema naman sa placenta previa, abnormal allocation or yung implantation mo, medyo nasa lower uterine segment. Okay, now, for both abruptio placenta and placenta previa, eto na, common risk factors, HAS, that's our code. History of previously having the condition. What does that mean? Yung dati nagka-abruptio, at risk pa rin. Yung dati nagka-placenta previa, at risk pa rin ngayon. So nagka-placenta previa sa dati, first pregnancy, second pregnancy, at risk pa rin siya. Age. Sabi ng ibang libro, above 35. Sabi ng ibang libro, above 40. Kuhanin natin pareho. So if the age is above 35 to 40, they are at risk for abruptio placenta and placenta previa. Next, substance abuse. Specifically, the substance cocaine could increase the risk for both abruptio placenta and placenta previa. In old literatures, nakalagay lang doon, risk factor lang yun na abruptio placenta. But new literatures would say it's gonna be a risk factor for both abruptio placenta and placenta previa. And of course, ang walang kawawa ang smoking. It's a risk factor for both. Now, ano naman symptoms, sir? Yung risk factor, sir, ang meron lang sa abruptio placenta. Okay, ang code natin, HIT-P, hypertension, infection, trauma, and premature rupture of membranes. Hypertension is the most common risk factor for abruptio placenta. For placenta previa naman, remember the code Mrs. M. Multiple gestation. Ibig sabihin, merong dinadalang tao, twin birth. Okay, hindi naman nagdadalang tae. Nagdadalang tao dapat. Nagdadalang tae, Hirschsprung's disease yun. Okay? Race other than whites, meaning yung mga Hispanics, Asians, okay, Africans, scars on the uterus, and multipara. Those who have had more than one viable pregnancy. So, Mrs. M. So, ngayon na meron na tayong konsepto, ganito mo dapat aralin yan. Identify mo ano yung common sa placenta previa at abruptio placenta, ilagay mo sa gitna, then i-cluster mo siya. Then, identify mo yung specific sa abruptio at specific sa placenta previa. Tsaka nga ngayon, sumagot ng tanong. Yan! So, visualize. If you would notice, class, I color-coded this para natatandaan mo. Pag blue, nandito sa abruptio placenta. Specific for abruptio placenta lang. Pag black, specific for placenta previa. That would facilitate it. Yung red, nasa gitna, present in both. Now, having that in mind, okay, let's answer the question. Trauma. Di ba nakita natin yan? HIT-P. Nasa ano lang yan? Abruptio placenta. So, ang tinatanong, I found in both abruptio placenta and placenta previa. So, we put an X. Hypertension. Again, sa abruptio lang yan, we put an X. Advanced maternal age. O, nasa gitna yan. Ayan. So, pareho yan. Previous history of the condition. Nasa gitna yan. Pareho yan. Multiparity. Ayun, nasa placenta previa yon. So, hindi yan found in both. Smoking and cocaine use, that's found in both. So, therefore, the answers are advanced maternal age, previous history with the condition, and smoking and cocaine use. So, sino pa matatakot sa SATA? Marunong ka ng mag-aral. Tatandaan mo, the key is marunong kang mag-aral. Hindi yung sinusulat mo lang yung sinasabi sa'yo, dididikta lang yung sinasabi sa'yo. No, that's old school. Hindi mo yan mapapakinabangan sa SATA. Okay. Now, punta tayo sa site. Okay. Na tinatanong din lagi, eating disorders, di ba? So if you talk about, maraming salamat, Jean Kylie. Okay. Thank you for saying this is amazing. Thank you so much for the appreciation. Thank you for the clap, Winifredo. Jennifer, salamat po for the appreciation. Ay, produkto ito ng aking walang kawawa ang pag-aaral ng ng ka-nursingan. Okay. Siguro magtataka kayo, no? Hindi ko actually first choice maging nurse, pero pinagsunugan ko ng kilay kung paano ko gagawing madali ito para sa mga estudyante ko. Grabe talaga si Sir, salute po. Maraming salamat siya. Okay. For eating disorders naman, so psych tayo. Paano mo gagamitin yung strategy na yan? Okay, here's a sample question. Which of the following manifestations are found both, eto na naman, in both anorexia nervosa and bulimia nervosa? So eto na naman ang mahirap. Tinatanong na naman yung found in both. Eh yun nga symptom ng anorexia, hindi pa natin makabisa. Symptom ng bulimia, hindi natin makabisa. Bibigyan kita ng pagkakataon. Mamaya, meron tayong coding dyan. Okay. Di na makalimutan, sir, tumatatak talaga sa brain. Salamat! Okay? My pleasure. Sana makapasa kayo at mag-tap kayo sa board para maging proud ang parents nyo. Okay? So, batch 2007 here, nostalgic. Okay. So, ang mahirap dito, self-induced vomiting. Ano ba yan? In both ba yan? O ano, weight loss? Ano ba yan? Fasting, skin and bone appearance, Russell sign. Meron pang Russell sign na tinatawag. Eh, ano ba yung Russell sign? Russell sign is actually the formation of callus here, okay, on the knuckles and at the back of the hand, because they're trying to use the fingers to stimulate the gag reflex to induce vomiting. That was actually named after the psychiatrist Gerald Russell. Kaya it's called Russell sign. Ngayon, saan ba yung nakikita? Sa anorexia, sa bulimia, or both? Here's our strategy. Okay, let's go with this functional concept. When you say anorexia, the main problem is fear of gaining weight. When you say bulimia, the main problem is alternate binge and purge. Okay? Binge, kakain ng marami. Purge, isusuka niya yung kinain. Okay? That's a means of the patient to compensate for the undesired behavior. Now, previously, before DSM-5, ang anorexia at bulimia, ang sinasabi, the most acceptable cause is the presence of individual factors. What does that mean? Conflict about growing up. Why? Because the parents of anorexics and bulimic are perfectionists. Lahat sinaklawan, pinakialaman. So sabi ni anorexic, nagrebelde siya, sabi ni bulimic tsaka ni anorexic, kailangan makontrol ko rin ang sarili ko at I can prove to my parents that I can still control myself. And what can they control? They can control the food that they eat. So anorexia and bulimia is about controlling what they eat. Actually, the term anorexia is a misnomer because anorexia, see, in medical terms means lack of appetite. Anorexic patients have appetite, but they suppress their appetite. Okay, so ano ang common for both the anorexic and the bulimic? Here's our code. Fared E. Okay, so fasting. Now, in the anorexic patient, they really do fast. Okay, lalo na kung yung pasyente natin ay may restrictive type of anorexia, sabi nga ng DSM-5. Abuse of laxatives, diuretics, okay, is present also in both because fasting and abuse of laxatives and diuretics is a compensatory mechanism for the bulimic. Kasi ang bulimic nangyari, kumain ng kumain, tapos bigla siya na guilty. Para matanggal yung guilt feeling niya, magfa-fast siya, hindi siya kakain uli. Okay, nagiging fasting and feasting yung kanyang pattern of food intake. And then, induced vomiting, hindi lang yan sa bulimia, present yan in both. Kasi in anorexia, we also have the anorexic purging type. So anong difference nun? Pag anorexia, the purging behavior leads in weight loss. Kaya nangangayayat, skin and bones. In bulimia, the purging behavior is just a means to relieve the guilt. Therefore, there's no weight loss in bulimia. Okay? It's either normal ang body weight niyan or is slightly elevated pa nga. Okay? Russell sign is found in both. Kasi in both conditions, there's going to be induced vomiting. Okay? Okay. So, and pay particular attention to the fact that, take note class, okay, your dieting and vigorous exercise could be present in both anorexia and bulimia. Okay, way to go. Now, paano naman kung gusto nating malaman, ano ba ibang symptom ng anorexia? Here's a code that I formulated since 1998. It's actually, the acronym is the mnemonic anorexia. Letter A used to be amenorrhea, pero tinanggal na kasi ang amenorrhea as one of the required manifestations of anorexia for its diagnosis. Kasi ang anorexia, nangyayari na rin sa male. So, A now means arrhythmia. And the arrhythmia is due to hypokalemia that could result from repeated vomiting that could lead to potassium loss. And then no organic factor accounts for the weight loss. What does that mean? Wala siyang ibang sakit para sa mag-weight loss. Okay? So remember, weight loss is prominent in anorexia. Obviously, thin but feels fat. Pag humarap siya sa salamin, tingin niya mataba pa siya. Pero in reality, skin and bones na siya. Refusal to maintain normal weight. Epigastric discomfort because of the abuse of laxatives. X symptoms. What are X symptoms? Ito yung mga peculiar behavior. You wouldn't think about this, but you know, anorexics love to collect recipes. They love to cook food. They love to eat with family members, but they don't eat with them. They just rearrange the food on their plate. Okay? So they love to cook foods. They love to collect recipes, but they do not eat. Okay, because that's a means of showing to their parents that they can still control themselves. So I call that the X symptoms. And then they have intense fear of gaining weight, which is the main problem. That's why their weight is usually 15% less than the ideal body weight. And then they always think about food. Now, what about for the bulimic? They have binge eating, kain ng kain. Pagkatapos kain ng kain, magda-diet kasi na-guilty sa dami ng kinain. Yung kinakain niya more than yung kinakain ng normal na tao. Then they lack control for the eating binges. And then after that, they compensate again. They induce vomiting. And there should be a minimum of 1 binge eating episode for a week for a period of 3 months. And then, take note of this, they have increased concern over body size or shape. How do we operationalize that? So yung anorexic, skin and bones na pag tumingin sa salamin, tingin niya mataba pa. Yung bulimic, okay? Alam na niyang payat siya. Pag humarap sa salamin, sasabihin niya, ay malaki pa yung puwet ko, malaki pa yung hita ko, malaki pa yung arms ko. Very specific ang problems niya. And because of that, they continue to engage in vigorous exercise and dieting. And of course, they also abuse laxatives and diuretics. Now that we know the signs and symptoms that are specific to the anorexic, those that are specific to the bulimic, and those that are found in both, let's go back to that SATA question. Tugisin na natin ang SATA question na yan. Sino pa natatakot sa SATA? Okay, which of the following manifestations are found in both anorexia nervosa and bulimia? Hindi na nakakatakot. Self-induced vomiting, yes, found in both. Weight loss, what did I tell you? Only in anorexia. We don't have that in bulimia, okay? Fasting, it's found in both. And then skin and bone appearance, okay, it's only in anorexia. And then Russell's sign, once again, remember the callus formation on the knuckles, then that's found in both. Sabi natin kanina, di ba, yung opening strategy natin, pag 5 ang option, okay, 2 to 3 usually would be true. You see? 3 ang tama, 2 ang mali. Okay? Pero hindi ko naman sinabi sa'yo, ha, na pagdating sa board exam, ang gagawin mo na lang, mamimili ka ng 3. Tapos after 30 minutes, sasabihin mo sa akin, Sir, tapos na ako mag-exam. Anong ginawa mo? Namili lang ako ng tig-3 bawat isang question. That's not something I would want to tell you guys. This is not a panacea. Gumamit ka pa rin ng sentido común, yung ating gray matter. Baka mamaya maglaho yan pag di natin ginamit, bababa ang value. Lalo na kung ang IQ natin pababa ng pababa, below sea level na ang IQ. Okay? Now, eto. Paano ko gagamitin yan, sir, sa CHN? Okay. Okay. Thank you very much, Russell. Okay. Naging entrepreneur na daw ako. Agyaman kami, Apo. O, agyaman ako at Judy Ann. Okay. So, paano daw sa CHN? Eh, di ba pinoproblema mo yung CHN na yan? Lalo na ngayon, isang buong test na ang CHN. Okay, ganito. One of the most commonly asked concepts na hindi pwedeng baliwalain ay ang herbal remedies. Okay? Ngayon, usually pag tayo nag-aaral ng herbal remedies, what do we do? Eh gagawin natin, ililista natin, tapos saan ito ginagamit? Tama naman, di ba? Yung Acapulco, ginagamit sa eczema. Yung bawang, ginagamit sa pambaba ng blood pressure. Yung ampalaya, ginagamit pampababa ng blood sugar. 10 lang ang aralin mo kasi yun lang naman yung nirecommend ng DOH. Okay, ngayon, paano pag ang tanong, eh hindi kung paano mo siya inaral? Paano pag ang tanong ay ganito? Let's try answering a sample question. The community health nurse, okay, should recommend which of the following herbal remedies for cough? Patay na. Yung question is based on the symptom. Now, which herbal remedies can be used for cough? Nako, anak ng Neneng, dapat pala ganun ko inaral yun. Clinaster ko, ano yung herbal remedies for diarrhea. Clinaster ko, ano yung herbal remedies for rheumatism, for fever. Dapat pala ganun. O, di ba? Ang hirap. So ngayon, alam mo na paano aaralin yan. O ngayon, dun sa 10 na nilista ng DOH, 3 doon ang pwedeng gamitin for cough. Ano-ano kaya yung mga yon? Okay, let's take a look at it. Sambong, yes, your sambong is a diuretic. It's also used to decrease uric acid and it's used also for cough and cold. So, nyug-nyugan, no. Nyug-nyugan is for deworming and sometimes it's used for fever and rheumatism. So, hindi ang nyug-nyugan. Bang-bangsit. Yung mga kapwa ko Ilocano, marami tayong bang-bangsit, di ba? Sa sementeryo, Camposanto, okay? Bang-bangsit in Tagalog is lantana. Hoy, wag niyong isnabin. Bang-bangsit is also an herbal remedy. Oh, thank you so much daw for the positivity. Salamat po. Oy, bang-bangsit is an herbal remedy. Kaya lang wala siya dun sa listahan na 10 ng DOH kasi yung mga ibang gumagamit na po poison. But bang-bangsit could be used for fever and rheumatism. So we put an X, okay? Yerba buena. Okay, pag sinabi natin yerba buena, yes, it's used for cough and colds and at the same time for rheumatism. And then the very famous lagundi, which is used for fever and cough and colds. So, once again, tignan mo yung formula natin. Basic strategy ha. 3 out of the 5 are true. So ngayon, alam mo na paano mag-aaral ng herbal remedies. Ika-cluster mo, alin ang para sa diarrhea, alin ang para sa cough, alin ang para sa fever. Ganun dapat. Okay. Now, what about pag yung tanong ay tungkol sa fundamentals in nursing? Like for example, infection control. Let's have a sample question. This is the best way to learn. Thank you very much, Liza. Okay, the nurse is providing care to a client with jaundice. Ano yung jaundice, sir? Yung after 9 months ang anak na jaundice? No, yellowish skin discoloration. Which of the following are essential aspects of isolation precautions for a client with hepatitis A? Now, take note, class. You're talking about a patient with hepatitis A. Alam mo, nung time namin, dalawa lang ang hepatitis A and B. Ngayon, A, B, C, D, E, F, G hanggang G na. Huwag mong antayin X, Y, Z na ang hepatitis bago ka pa mag-board exam. At makuha yung lisensya mo. Ang hepatitis hanggang X, Y, Z na. Okay, now, take note, class. Ang dinidiscuss ko lang, usually, hepatitis A, B, C, D, E. Kasi yung hepatitis F is just theoretical hepatitis. Somebody applied for its patent pero wala pang nadadiagnose with hepa F. Ang hepa G naman, initially, the studies said that the virus only causes hepatitis in animals. I therefore conclude, beyond reasonable doubt, pag nagka-hepa G ka, animal ka. Okay, now, done with all those things. What do we need to remember about hepatitis? You need to implement standard precautions. When you say standard precautions, it's meant to protect the healthcare workers. And if we are implementing standard precautions, there is no need for the private room. Bakit? Ilalagay ba natin sarili natin sa private room? Eh di wala na nag-duty, so we put an X. But since we are discarding the patient's bedpan that contains excretas, okay, the excreta, the urine, and the feces, we need your gloves and gown. Your N95 mask is needed if you're dealing with patients requiring airborne precautions. 4 lang yon, MTVS. So measles, tuberculosis, varicella, and SARS. And so we put an X, and then surgical mask for all client visitors. Now take note, class. Surgical mask for all client visitors, this is done for the reverse isolation precautions if your patient is having chemotherapy and radiation therapy. Now look at this, class. Sinabi ko sa inyo kanina, be very careful. Hindi sa lahat ng pagkakataon, 3 ang tamang sagot. Diba? We said 56%, so 2 to 3. Okay? So look at this question. It only has 2 correct answers. Okay. So, natuto ba kayo with the first strategy? First strategy pa lang yon. We're supposed to talk about 5. I hope you still have the energy. Let's move on. This is strategy number 2. Pasok! Focus on the purpose, patient preparations, and post-procedure risk and complications. So para saan yung strategy na yan, sir? O, wag nyo nang kopyahin, bibigay ko naman sa inyo to slide na to. Aanin ko to. Hindi naman na ako magbo-board exam. Sinishare ko na nga yung mga na-formulate kong strategy. Sa inyo na yan, no? Tapos na nga ako. Bawal naman mag-take ulit ng board exam. Okay, let's move on. So this strategy is for diagnostic procedures, okay? Whether this is done to prepare the patient, okay, for a specific procedure. Now, ito ngayon ang tanong. Sir, alin ba sa mga procedures ang aaralin ko? Lalo na para sa SATA. Ito lang masasabi ko. Yung mga procedure na kailangan mo ituro sa pasyente mo, yun ang aralin mo. Example, sir, self-breast exam. Diba? Ituturo mo yun sa pasyente mo eh. Kasi kaya kailangan mo aralin. Alamin mo step by step. Crutch walking. Kailangan mo ituro yun eh before the patient gets discharged. Di ba? Insulin administration sa diabetic. So yun lang i-memorize mo. Huwag mo memorize ang steps ng CT scan. Hindi talaga yun ang nararapat. You see? So pag nag-aral ka ng procedure, tanungin mo sa sarili mo, ito ba ay kailangan mo ituro sa pasyente mo? Kung kailangan mo ituro sa pasyente mo, i-memorize mo. Chances are lalabas yan sa SATA. Ganun lang yun. Ngayon, let's have a sample question. Blood transfusion. O, ayan na. Ang blood transfusion, make sure tamang blood type ang tinatransfuse. Diba? According to the blood type tsaka RH status. Sabi nung iba, according na rin daw sa gender. Bakit? Meron bang tinatransfusion ng green blood? Verdadero? Okay, let's move on. Okay, so let's talk about blood transfusion. Here's a sample question. Which of the following manifestations indicate transfusion-related acute lung injury or TRALI? Ayan na. Sir, ano yung TRALI na yan? Noong panahon namin, hemolytic reaction lang, pyrogenic reaction lang, allergic reaction lang. Yan lang yung panahon namin eh. Ngayon, the most common cause of mortality and morbidity related to the first 6 hours after administration of blood transfusion are the conditions known as TRALI and TACO. Sir, ano yung TRALI? Ayan nga, transfusion-related acute lung injury. Ano naman yung TACO? Transfusion-associated circulatory overload. Yung TACO, hindi yung kinakain. So, dati, mga pyrogenic lang, hemolytic, gano'n. Ngayon, ayan na, dinagdagan ng TACO at TRALI. O, paano na ngayon yan? O, ganito mo siya aaralin. Transfusion-related acute lung injury is characterized by acute respiratory distress, pulmonary edema, and hypoxia that occurs during or after a transfusion. It occurs within 6 hours after a transfusion. So therefore, if you're going to take a look at these two common conditions, ano ang unifying factor ng TACO at TRALI? In both conditions, may pulmonary edema. Okay? So you have TACO, you have transfusion-associated circulatory overload, and there is cardiogenic pulmonary edema, which means, okay, the pulmonary edema originated from a condition in the heart. So it could be related to congestion. Okay. TRALI, transfusion-related acute lung injury, you have non-cardiogenic pulmonary edema. So hindi galing sa puso. It could be related to an autoimmune reaction, which is a reaction of the body to the transfused blood. So in essence, ang common sign ng TACO ay hypertension, but only 1/3 of patients with TACO would usually have fever. So they have yet to identify fever as a common sign of TACO. So no fever, and there is no decrease in WBC, which is in contrast to TRALI. In TRALI, the patient will have hypotension, fever, and leukopenia. Therefore, okay, if you're going to identify ano ang priority vital sign mo dito, blood pressure. It's common in both. TACO, you have hypertension. TRALI, you have hypotension. Your temperature monitoring is specific for TRALI kasi dito ka lang merong fever. Okay? And look, there's a corresponding decrease in WBC. So, what is common in TACO and TRALI? Pulmonary distress. So, there's gonna be, okay, shortness of breath, there's gonna be dyspnea, there's gonna be tachypnea. That eventually decreases oxygen, leading to cyanosis. Okay? And then in both conditions, may pulmonary edema. Cardiogenic pag TACO, non-cardiogenic pag TRALI. Now, since TACO and TRALI are transfusion-related complications, take note, class, okay? The priority is to stop the transfusion, then replace it with NSS, and then report the patient to the physician. Okay, just to add on your existing knowledge, let's recall yung ibang blood transfusion reaction na common. If the patient develops fever, okay, suspect pyrogenic reaction. If rash occurs, anaphylactic reaction. If there's backache, hemolytic reaction. And usually the backache comes with fever and chills. And then moist cough would be circulatory overload, and high fever with vomiting indicates sepsis. Now, let's try answering the sample question. Who's afraid of SATA? No more. Okay, wala na, no one. Low back pain and nausea. This is hemolytic reaction. Okay, fever and chills, that's also hemolytic reaction. Dyspnea and hypotension. What did we say? Mababa ang BP sa trolley? Yes. Tachypnea and cyanosis. Yes, nasa gitna yan. Sign yan ng pulmonary edema. We put a check. Orthopnea and hypertension. Now, this hypertension makes that the opposite. Sa taco yan. So we put an X. And then pulmonary edema is found in both trolley and taco. So we put a check. So this is again, 3 out of 6 would be the correct answers. Okay, now, paano naman pag ang question ay ang walang kamatayang tungkol sa colostomy? Here's a sample question. Which of the following steps are appropriate to include in teaching a client with on colostomy irrigation? So a common problem in colostomy irrigation would be cramps. But take note, class, the cramps should be transient. If it goes beyond 3 hours, you need to report that to the physician. It could mean something else, not necessarily associated with the temperature of the fluid that was used for the colostomy irrigation. So clump off the flow of tubing when discomfort occurs, that's correct. When the cramps disappear, you can continue. But if it persists, refer to the physician. Stop the colostomy irrigation. Okay. Maintain the temperature of solution at 100 to 105 degrees Fahrenheit or 37.7 to 40.5 degrees centigrade. That's slightly above the normal body temperature. That is correct. Remember, it should be warm, not hot. Hindi naman magluluto ng siomai dun sa loob ng intestines, no? Prepare 500 to 1,000 cc of solution, then lubricate the tip of the catheter before inserting it into the stoma, and then hang the irrigation bag on the bathroom door closed. So, no. Okay? Kasi pag hindi niya nakayanan, bagsak, it's gonna be a messy procedure. Now remember, the best time to do colostomy irrigation is to approximate the time by which the patient would usually have bowel movement so that it is aligned with the patient's lifestyle. So every morning siya umi-evac, so every morning din magko-colostomy irrigation. Ganun dapat yon. So what are the pointers now? If you have ascending colon colostomy, there will be liquid feces. If you have the colostomy on the transverse colon, you will have semi-solid feces, and on the sigmoid colon, you'll have solid feces. Now take note, for the first 72 hours after the creation of the stoma, there's no discharge at all. That is expected. Why? Because peristalsis usually returns after 3 days or 72 hours, and the stools start to become formed around the 7th post-operative day. Now, when there is difficulty inserting the tube, that could mean there's stricture development in the stoma, so report that to the physician. And then irrigate the colostomy when the client would have normally had a bowel movement to maintain their lifestyle. So, here's a functional concept. A post-colostomy patient can engage in swimming, running, or weightlifting, and they can get pregnant. Okay, empty the colostomy bag when it is 1/3 to 1/2 full. You don't have to wait for it to be so full. Okay, full capacity before you empty it. That's not the right thing to do. And what about addressing patients' concern? What is the diet after surgery? Usually clear liquid for 1 to 2 days. Now, the normal colostomy stoma would be moist, edematous, and without sensation. It could sometimes bleed when rubbed because the mucous lining could be very sensitive, so this is expected. Absence of fecal discharge for the first 3 days, this is expected. No control of bowel movement, now this is also expected. Okay, now, when a patient will have problems related to gas, okay? So what do you mean by the presence of gas? Medyo nauutot, di ba? Eh, meron namang magandang epekto yung pag-uutot eh. Di ba? Kasi sabi nila, if you're gonna analyze it, it's not oxygen that stimulates the respiratory center in the pons, di ba? It is carbon dioxide. Oh, eh, saan ba nanggagaling carbon dioxide? Eh, di mag-fart. For as long as it's not done directly onto your face, then it serves its purpose. O, di ba? Source ng carbon dioxide. Meron pa naman ibang source eh. Wag na lang yon. Okay, so let's move on. So yung gas, you have to avoid common gas-forming foods. In a nutshell, yung mga vegetable gas-forming yan. Pero may 5 foods na nag-uumpisa sa letter C na kailangang iwasan. Okay? So limit dried beans, peas, broccoli, cabbage. Ayan, cabbage, cheeses, cucumber, coffee, and carbonated drinks. Now take note, class. Yung coffee, avoid yon. Pero pag decaffeinated, pwede. Okay? Now your onions could also cause gas formation, okay? And when there's increased odor, limit onions, cabbage, garlic, eggs, fish, and fried foods. And to prevent obstruction, limit popcorn, nuts, corn, apples, strawberries, and tomatoes. Those fruits would usually have small seeds, and the corn kernels could potentially block the stomach. Okay, so now, knowing this, okay, I know for a fact, marami na kayong natutunan tungkol sa ating second and first strategy. Now, let's move on to strategy number 3. Ayan, strategy number 3, ask yourself, what system or systems is or are affected by the disease? Ito kasi problema natin. Masyado tayong focus sa pathophysiology. Pag nag-aral tayo, gusto natin pati yung micro level, cellular level, minimemorize natin for the boards, AAA. Gustong-gusto mo na meron kang alam na ikaw lang nakakaalam. Isa lang masasabi kong payo bilang mentor mo. Pag meron kang nalalaman na ikaw lang ang nakakaalam, hindi yun lumalabas sa exam. Kasi ikaw lang nakakaalam eh, di ba? Hindi rin yun. Hindi rin familiar yung ibang tao. So, stop memorizing trivial things. Yun lang ang gusto ko sabihin. Yung iba kasi, di ba, graduate ka nga with honors, tapos hindi ka nag-top ng board. Bakit? Kasi masyado kang focus doon sa gusto mong pag-aralan, yung ikaw lang ang nakakaalam. Eh, pag ikaw lang ang nakakaalam, wala nga ngayon. Stop doing that. Don't focus on trivial things. Okay. Now, say for example, let's talk about multiple sclerosis. O, di ba? May tinatawag multiple sclerosis, myasthenia gravis, Guillain-Barré syndrome. Okay. So what do you do? How do you study? Go back to the most basic concept. So let's try answering a simple question. In a client with multiple sclerosis, which of the following manifestations can be observed in a client? O, ayan na. Sa dami ng mga sakit na pinag-aralan mo, biglang sasabihin, may immunodeficiency ba to? Alam ko autoimmune to eh. Same ba yung autoimmune sa immunodeficiency? May pain ba ito? May bleeding ba ito? Nagkahalo-halo na. Normal lang yan. Don't despair. Now, let me organize your thoughts for you. Here's our strategy. So when you study multiple sclerosis, go down to the most basic, most broad, okay? The most general problem. And what is the main problem here? You have demyelination of nerve fibers in the central nervous system, which means destruction of the myelin sheath, the protective coating of the nerve fibers. And what system is affected? The central nervous system. Ay, pag central nervous system, brain and spinal cord yan. Pero pag multiple sclerosis, kasama ang brain, kasama ang spinal cord, kasama ang optic nerve. Okay. So if the brain is therefore affected, ano ang symptoms? So the patient will have slurred speech, okay? Lalo na kung affected ang frontotemporal lobe, dysarthria. Okay, ano ba yung dysarthria? Inability to articulate oneself because the muscles for articulation are affected. Ano ba ibig sabihin na articulate? Maarte na, makulit pa. Articulate means able to express oneself. So, if you are unable to articulate yourself, hindi mo ma-express yung sarili mo verbally. Okay? Then the patient would have dizziness, tremors, depression, especially that multiple sclerosis is a chronic condition. And then the patient could have mood swings. Sometimes they get depressed. Sometimes they have a little excitation. And then they have ataxia. Ano ba yung ataxia? Yung ba yung sinugod siya? Ataxia. No, ataxia means impaired balance and intentional tremors. Now, how is intentional tremors different from pill-rolling tremors? Pill-rolling tremors occurs in Parkinson's disease. It occurs when the patient is not doing something. That's why it's sometimes called resting tremors. Yung intentional tremors, kung kailan may ginagawa yung kamay, tsaka nanginginig. Okay? That's what happens in multiple sclerosis. Now, your optic nerve could also be affected. So there could be optic neuritis that could actually lead to blurry vision, double vision, and eventually loss of vision. Kaya nga, initially, ang common complaint ng may multiple sclerosis ay impaired vision. Kaya kailangan nila ng corrective lenses. And then finally, when the spinal cord is affected, the patient will have numbness. Okay, weakness, okay, rigidity of the muscles, kaya binibigyan sila ng Valium, di ba? Yung Valium bawal sa may Guillain-Barré, pero pwede sa may multiple sclerosis because of muscle rigidity. Then they also have stiffness, and then bowel and bladder dysfunction and impaired sensation. Kaya hindi pwedeng mag-hot water bath ang may multiple sclerosis. Why? Kasi hindi nila mararamdaman yung temperature ng tubig. They will be prone or at risk to burns. And they have the so-called thermit sign. Now, this is pronounced thermit, hindi lermit. Thermit sign. Now, thermit sign is a type of neuropathic pain that is elicited when you ask the patient to bend the head forwards. So there's going to be an electric shock-like sensation on the neck and the head. So that is neuropathic pain known as thermit sign. Yan. Okay, now, so let's try to answer the sample question. In a client with multiple sclerosis, which of the following manifestations can be observed in a client? So in multiple sclerosis, what is affected? Central nervous system, the brain, the optic nerve, the spinal cord. May narinig ba tayo kaninang immunodeficiency? Wala. So we put a next. Double vision. Oops. Optic nerve affectation. Yes. Ataxia. Yes. The brain is affected. Muscle stiffness and muscle weakness. Yes. Associated with the affectation of the spinal cord. Bleeding. Meron ba tayong narinig na bleeding kanina? Wala. Pain. Yes. You have your neuropathic pain. Thermit sign. Put a check. And that's how it goes. If you would notice, mas marami na naman ang true kesa sa false entries. Okay! Way to go. Okay. Class, strategy number 4. Okay? Identify normal and abnormal findings. Eto, dito tayo minsan nahihirapan. Bakit? Memorize tayo ng memorize ang mga normal values. Tapos, nung take ka na ng exam, ang lumabas isa lang, yung hindi mo pa alam. Kaawa-awa ka naman. Nahulaan ko ba? Sinulat mo, dami-dami sa papel, dami-dami sa notebook, lahat ng normal values. Nagkakanda bulol-bulol ka every morning, memorize ka ng memorize. Kahit sa panaginip, mini-memorize mo na. Okay? Kahit na nagmo-moment na kayo ng jowa mo, ng asawa mo, habang naghahani mo, nagme-memorize ka na. Tapos, nung nag-board exam, isa lang lumabas yung hindi mo pa alam or yet nakalimutan mo. Ang sakit naman. So let me give you a strategy. So how do you go about studying normal values? So you have to identify normal values, don't memorize, together with your nursing diagnosis. Kunwari, if the patient has a pulmonary tuberculosis, sir, ano ba yun? Ineffective breathing pattern or impaired gas exchange. Then you go down to the data. Okay? So kung ang apektado muscles of breathing, then that's gonna be ineffective breathing pattern. Pero pang ang binigay sa'yo, ABG result. Okay? Kunwari, mababa ang pH, mataas ang carbon dioxide. So that's gonna be impaired gas exchange ang nursing diagnosis mo. Let's give life to this. Okay? Okay, para hindi ka mabigo. Okay. Natutulala sa kaka-memorize. Tingnan natin ang ECG na pinagtitripan yan. Huwag kakalimutan. Take a look at this class. So these are your normal ECG waves. Okay? Nung panahon namin, PQRST lang yan. Ngayon may dumagdag na naman. P wave is representative of atrial depolarization. What do you mean by depolarization? Okay? It simply means stimulation that could potentially lead to contraction. So hindi ibig sabihin na depolarization magko-contract ka. Ibig sabihin na stimulate. Okay? Na pwedeng would lead to contraction. Then QRS is representative of ventricular depolarization or contraction. And then T wave is representative of ventricular repolarization. Now, notice you have a space between your S and T waves. Okay, this is what is referred to as your J point. Okay, that signifies the end of depolarization of the ventricles. That's your J point. Now, after the T wave, there is a small wave here, and it's called U wave. And it's indicative of the repolarization of Purkinje fibers. Ngayon ang tanong, sir, pag tinanong sa SATA, which of the following are included as normal ECG waves? Isasama ba namin yung U wave? Depende. Pag small U wave, yes. Pero pag ang nakalagay dyan, prominent or visible U wave, that's indicative of hypokalemia. Okay? So let's try to utilize what we've learned and answer a sample question. Which of the following changes occur in the electrocardiograph of clients with potassium level of 6.0? Na pag sinabi natin potassium level of 6.0, kailangan i-recall mo yung normal potassium, which is 3.5 to 5.3. So 6 is already elevated. So here the patient's having hyperkalemia. So what did we say a while back? Di ba ang U wave is indicative of hypokalemia? Yes. Pag hyperkalemia, ang elevated o ang nakapik ang T wave. And it's called the Eiffel Tower pattern of the T wave. So Eiffel Tower, okay, wide ang base. Okay? So ang U wave, hindi kasali. Okay? Sawtooth pattern of waves, this is indicative of atrial flutter. When you have enlarged P waves that are 2 to 3 in between two QRS complexes. So you have regular QRS complexes with enlarged P waves that has become the F wave. So this is your atrial flutter. So that's an X. It doesn't occur in hyperkalemia. Tall peak T wave. I told you about this with ST depression. Yes, this is related to hyperkalemia. Shortened QT complexes. Now, if your QT complexes is actually shortened, meron ba nito sa hyperkalemia? Actually, yes. Because if it is prolonged, you have hypokalemia. If it is shortened, you have hyperkalemia. And the normal QT complex would be 0.4 to 0.44. Okay? Second, narrowed QRS or widened QRS. Ito na yung mahirap. Kasi directly opposite sila. Tapos magkasunod pang number. Di ba? Ito yung nangyayari sa'yo. Dalawa lang nga lang naliligaw sa'yo. Isa na lang ang pipiliin mo, doon ka pa sa maliit na punta. May hugot. Okay, ganyan din nangyayari sa SATA. Pag merong directly opposite na ganyan, di mo na alam, mali na kaya dito. Okay, what did I tell you, class? Sabi natin kanina, hyperkalemia, you have the Eiffel Tower pattern of the T wave. So wide yung base. So hindi narrowed ang base. Kasi ang narrowed QRS complex is associated with supraventricular tachycardia. So X yan. So ang tama, widened QRS. So always remember, if you have opposite items, isa lang ang pipiliin mo. Hindi yung opposite, pinili mong dalawa. Chances are, mali ka na doon. Okay? So those are the things that you have to remember. Okay, now, what about strategy number 5? Oy, panghuling strategy na tayo. Huwag kayong mabibitin. As I've been saying, class, I will conduct a full free session on SATA on November 8. You're going to be asked to register separately for that. I will be giving out extra and sample materials. Okay? So that's going to be for all of you guys. I wish you the best. So strategy number 5. Okay. Focus on discharge instruction. Dito tayo minsan mahina. Umamin tayo. Kasi pag nag-discharge tayo ng pasyente, excited na tayo dahil sa pagod. Hindi na tayo nagbibigay ng discharge teaching. Hindi tayo nagbibigay ng discharge instruction. Okay, so here we go. Okay? Now, one of the most common discharge instructions that we give would be to patients from the OR. O hindi din yan nawawala sa test, no? OR nursing. So what would be your discharge instruction? Remember, post-mastectomy instruction. So let's have a sample question. The nurse is providing instructions to a client after mastectomy. Which of the following instructions are appropriate? Bruising and swelling are danger signs. Now take note, any surgery, may bruising at swelling. These are not danger signs. These are expected manifestations. So we put an X. Avoiding venipuncture on your affected arm may be required. Look at the last phrase, for the rest of your life. Diyan, nagkaroon ka ng, ay, ano kaya yan? For the rest of your life ba yun? Ganito. Okay? Ganito. Okay? Sabi ng mga eksperto na gumawa ng pag-aaral, okay, na nakapublish naman yan sa Oncolink, when the lymph nodes are removed during mastectomy, they don't regenerate. So the risk for lymph edema is lifetime. Therefore, yung pagbabawal ng pagtutusok sa affected arm should also be lifetime. So we put a check. Yan. Okay. No BP taking on your affected arm as instructed. Okay. Sometimes, ito nag-aaway ang mga eksperto. Sabi ng iba, that's only needed to be done for 2 to 3 years after mastectomy. Sabi naman ng iba, no, because lymph edema is a lifetime problem after mastectomy. So better yet, as instructed. So tama naman ito. Okay. You can shower immediately after the procedure. Now, take note, class. Showering can only be done 24 to 48 hours after the removal of the drain, either Jackson Pratt or Hemovac drain. Pero yung drain kasi stays in place for 1 to 3 weeks. So during that period, half bath lang, from waist down lang ang binabasa. Okay? So sa taas, pwede ka ng sponge bath. Okay? So this is an X again. So your risk for lymph edema is not lifetime. No, the risk is lifetime. So we put an X. And then you may need to elevate your arm above the level of your heart. Yes. Okay, so remember this functional concept. Lymph edema is an incurable and progressive condition that might require following specific recommendations for life. Okay, with the 5 strategies that I have given you, class, remember, smart guessing using the strategies would be better than than wild guessing. So remember, there is no substitute for knowledge gained from what you learn, but make sure you gained knowledge, because information is not knowledge. If what you have are just written information, if what you have are just handouts, if what you did to study would just be to write down notes dictated by somebody else, that is not knowledge. Information becomes knowledge if you can convert it to strategies that becomes usable when you take a test. Okay? So, let me end with this quote. Life is an echo. What you send out comes back. What you sow, you reap. What you give, you get. What you see in others exists in you. Therefore, do not judge, so you will not be judged. Radiate and give love, and love comes back to you. And if I may add, if you do your best, you will definitely pass the test. Okay, now, colleagues, listen up. Type it in your chat box. Say, I'm next. Come on, everybody say, I'm next. Come on. Type it in your chat box. Everybody say, I'm next. Come on. Okay, everybody, those who will type it on the chat box would actually have, okay, higher ratings than those who will not. Okay, everybody say, I'm next. Come on, I'm next. Everyone, we are 1,000 in this webinar. Okay, so class, this is the inspirational story that our email sender initially told us about. Okay, hindi ko naman tinatago yan, no? Jollibee crew boy ako nung ako'y college student. Ito yung tsura ko noon. Nasa grill station. Okay, yan ang ID ko. Okay? At yan ang sweldo ko, 11.25 per hours, 920.93 bawat kinsenas. At sa pagtsatsaga ko ng pagja-Jollibee boy, of course, nakagraduate ako ng nursing. And eventually, kasama ko na as Philippine representative sa World Entrepreneur Summit, si Boss Tony Tan Kak Chong, who owns Jollibee. Okay? That after I've been awarded as Ernst & Young Entrepreneur of the Year, and proudly, bilang kauna-unahang nurse, na na-accept sa Ernst & Young Entrepreneur of the Year Academy. Yan po ay dahil sa suporta mula sa ating mga samahan sa propesyon. Okay? So, sabi nga, do not be contented with what you have. This is a goal that I have to challenge you to achieve. And ito lang ang aking final message. I'd like to play this video na ginawa ng isang estudyante para sa akin. It's entitled, Go the Distance. Okay? So, I just hope you like this. I have often dreamed of a far-off place where a hero's welcome would be waiting for me, where the crowds will cheer when they see my face, and the voice keeps saying, this is where I'm meant to be. I'll be there someday. I can go the distance. I will find my way. If I can be strong, I know every mile will be worth my while. When I go the distance, I'll be right where I belong. Think you can and you will. Just believe. To embrace my faith, where the road may wander, it will lead to you. And the 1,000 years will be worth the wait. It might take a lifetime, but somehow you see me through, and I won't cry. I can go the distance, and I'll stay on track. No, I won't accept defeat. It's enough, he is low, but I won't lose soul. Till I go the distance and my journey is complete. But to look beyond the glories, the heart is part for a season measures from his side. Just believe, class, you will. It's all in the heart. Come on, here we go. One more time. Like a shooting star, I can gauge the distance. I will touch the world. I will face its sun, and I don't care how far. I can go the distance till I find my hero's welcome waiting. You're wrong. Di pa po tapos. Meron pa. May effect pa yan. I will search the world. I will praise its songs till I find my heroes welcome waiting in your arms. Sayo ng lolo. Okay? Thank you so much for hearing out my final message to everyone. And let me leave you with this na nakalagay po sa YouTube channel natin from Marites Valdez, the YouTube channel watcher. Thank you so much, Sir Ray. I passed the Saudi Prometric. This is just a day ago. Exam for nursing specialist dahil sa free review sa YouTube channel mo. More power po, sir, and God bless you more. Marites Valdez of Lorma Colleges, La Union. And I said, congratulations and God bless you. Thank you for the trust. Spread the news to your friend. And she says, you are indeed an angel sent from heaven. Ayaw nila ng naughty angel, kaya dinala ako sa lupa para sa lahat ng aspiring nurses to achieve higher levels in their career. Again, thank you so much po, sir. And the least I can do to repay you po is to watch the ads in your channel while reviewing para sa marami ka pong natututunan. So doon sa mga 2,000 plus pa na nag-aantay ng ating slightly delayed telecast dahil nga hindi kinaya ng ating Zoom, dumagsa ang gustong matuto. Wait po, you will realize your dreams. Maraming salamat for sticking out with us. And also, I'd like to congratulate another NCLEX mentee of mine, Arlene Faith Bersano from San Pedro College, Davao, who passed the Northern Mariana Islands Board of Nursing test. Okay, congratulations. Sana sumunod kayong lahat. Everybody say thank you. Okay, so who's still afraid of SATA? After those strategies, pag takot ka pa, wait mo. Sa November 8, meron akong libre, mahabang session, at maraming material, saksak mo sa baga mo. Okay, so thank you so much, dear colleagues and future colleagues in the nursing profession. My love is for everyone. From my heart, maraming salamat po. And I'll be open for your questions at our open forum. So thank you so much and stick around for the more important presentation of Dr. Glenda S. Arquiza. Thank you, Sir Miko. Back to you, Sir Miko and Ma'am Dre.
Thank you so much, Sir Ray. Grabe, may pa-concert pa si Sir. Sir, hindi mo naman sinabi magpapa-concert ka na. Kailangan ko rin, syempre kailangan may contribution din kami dito. So, ang contribution ko lang, ang advice ko lang din, maikakanta ko para sa ating mga participants ngayon is just once. Okay? Okay, can we figure out doing wrong, di ba? Deconstructing SATA questions.
Pero Sir Miko, sana wag yung first phrase no na kasi di ba yung first phrase na yung I did my best but I guess my best was wag yun. Dapat doon lang sa chorus. Correct. Just once lang yon.
Just once lang tayong lahat. Just once lang kayong lahat magtitake ng
So
nursing.
dapat pala ang motto natin ay we pass aswang. Hindi aswan, aswang.
Yan,
Okay.
opo, tama, sir. So again, sir, maraming salamat. And
You're
later
most
on,
welcome. Yes.
to our participants, of course, you may ask your questions about deconstructing SATA or any other tips that you would like to ask from Dr. Ray or Sir Ray, and of course, Ma'am Glenda later on during our open forum. And dun sa mga nagtatanong pala dyan, we will be sending an exclusive link and email to you, lalo na dun sa mga attendees or mga classmates nyo, baka mga colleagues nyo, mga kasama nyo, na hindi man nakapasok dito sa Zoom room, we'll be sending them, basta nag-confirm sila ng attendance, ng email so that they can watch yung recording ng video na to. So, you too will be sent a recording so that at least you can revisit or rewatch yung mga naging session natin. So, yay! Tama, Mariel. Whatever we may imagine, more thanks because it helped a lot to them. Yes, definitely. Gusto nating makatulong sa libo-libong nurses, libo-libong future RNs natin.